Greetings today. I'm privileged to welcome you all to our Health Talk series, organized by the Student Council of Sadhabai Raisoni Women's College, supported by SJR Knowledge Foundation, and powered by Raisoni Group of Institutions. Our eyes do wondrous things. Through a complex system, they take in information and have a direct connection with your brain, allowing you to visually process the world around you. You wouldn't think that people actually neglect caring for their eyes, but they actually do. So, today, to talk us through the importance of caring for eyes just as much as we care for other parts of our body, we have Dr. Gitanjali Sharma, a consultant eye surgeon with numerous achievements in her kitty. A highly trained specialist doctor, Dr. Gitanjali Sharma is a renowned doctor who believes in providing quality information to her patients about their health condition and management, and she also strives to provide the latest and best medical services in the field of ophthalmology. She has also developed a prevention of blindness model in leprosy patients, which she presented at the International Oculep and the IAPB Assembly at Dubai. And she underwent her higher training in various aspects of ophthalmology at the prestigious Shankara Netralaya Chennai Arvind Eye Hospital, Coimbatore, and LV Prasad Hospital. She was also a member of a group study exchange program to Brazil and underwent higher training at centers in the UK and Israel. She was also awarded a fellowship in cornea at Bordeaux in France. Ma'am, I must say you have a very impressive and distinguished profile, and I'm sure our audience is very keen to get to know more about you. So without further ado, I would like to hand over the session to you.
Thank you, ma'am. Thank you for inviting me today. It's my pleasure to give knowledge about ophthalmology and eye care to all the students of Raisoni Institutes. Let me share my presentation now. Can you see my slides?
Yes, we can. Yes, we can.
Yes, here I am, Dr. Gitanjali Sharma. I am the past president of Pune Ophthalmological Society, and presently I am the honorary secretary of Indian Medical Association Pune. Through both these platforms, we are doing a lot of social activities so that correct knowledge and awareness programs reach to each and every person of the society. As you all know, presently we are observing National Fortnight for Eye Donation. So I take this opportunity to request all of you to take a pledge for eye donation. So here I go with my presentation for your eyes only. Before I start my presentation, here I pay my homage to more than 800 doctors who have martyred and many more healthcare workers who martyred in the COVID pandemic giving services. So let's salute to them and start our presentation. Though COVID has come to an end, I request all of you, whenever you go to clinics and hospitals, please wear masks. Masks are important even today to prevent all kinds of infection, because presently, along with COVID, H1N1, swine flu, and other respiratory disorders are increasing. So please take care and wear mask whenever you go. Whenever you are wearing mask, wear it properly over your nose and not only on your mouth. So let's now learn something about eye. As you all know, eye, the main function is vision. This beautiful world we see through our eyes. But for us, ophthalmologists, we consider eye as windows of our body. Anything that happens inside our body can be seen through eye. So this is a very magical organ of our body. Let's learn a little bit about anatomy of the eye. When you see with the torch, you can see the pupil, which is the centermost small circular thing. Ma'am, can you help me to have the marker or laser pointer? Because I don't find it over here.
If you're running a presentation, it should kind of come on.
Yeah, now I got it.
Yeah.
So this is the small pupil that you all see with the help of a torch. This is the eyelid, this is the sclera. The colored portion is called iris, but the most important is the pupil, which accommodates and makes us see better and better. If you see the anatomical structures of this eye, then you will find this is the lens, which works like a camera lens. And so whatever light falls on the eye, it focuses on the retina over here. This anterior most portion is called cornea, which is a transparent layer and which makes us see clear. So this cornea needs to be transparent and the lens also needs to be transparent to focus on the retina. And this is the retina where exactly the image is formed and you see clear. Knowing this, now we understand what is vision. In vision, whenever the light falls on the eye, it focuses on the retina and an image is formed which is carried from this optic nerve to the brain. That is how we see the things. That is the vision. So when you go to any eye doctor, they check your vision. They check your visual acuity. There is a chart on which they ask you to read letters or numbers. That is called visual acuity. But along with visual acuity, there are also visual fields. Whenever I'm looking straight, I know something is on this side and on this side as well. Whenever you are driving a vehicle, you know, even if you are looking straight, there are things around you which you have fair idea of. This is called visual field. And then, of course, the color vision. You have to differentiate between red, green, blue, white. That is called color vision. That capacity, everyone has it. Those who don't have it are color blind, and I'll tell you how to check and diagnose color blindness. Now, when you see visual acuity, there can be myopia. In myopia, the eye is slightly longer. The anteroposterior axis is slightly longer, and because of that, the light focuses in front of the retina. When it is hyperopia or hypermetropia, the light focuses behind the eyeball. And whenever there is a third condition called astigmatism, where the line gets refracted and it forms image not at a particular point, it doesn't get focused at a particular point. So refractive errors, a myopic eye is longer than normal and the cornea is steeper. So the light rays focus in front of retina. So the close objects are clear, but the distant objects appear blurred. It is called short-sightedness. Similarly, in hypermetropia, since the light focuses in front of retina, the near objects are not seen clearly. And in astigmatism, it is the blur vision for both near and far objects. It's almost like looking into a funhouse mirror in which you appear too tall or too wide or too thin. So how do we correct this refractive errors? Now in myopia, the light is focusing in front of retina, so we give a concave lens, that is the spectacles, so that these concave lens focus the light perfectly on the retina. Similarly, in hypermetropia, we give the convex lens so that the light focuses exactly on the retina. There are different types of treatments for refractive errors. First, I told you spectacles, but we can use contact lenses. We can use laser refractive procedures, which are very, very popular nowadays. So there is LASIK, there is SMILE, there is PRK. There are many others, but these are the main which are used today. And we can also do surgeries for removing the refractive error, like lensectomy, giving rise to clear lens exchange, or phakic intraocular lenses, or corneal inlays. When I'm talking about spectacles, all the children, teenagers, and students must remember how to use spectacles. You should always have good habits. Clean your spectacles always. If the spectacles have dust on it or fog on it, then your vision is not clear, and that will affect your vision as well as your number will keep on increasing. In last 2 years, because of COVID, there were e-schools and e-studies. So a lot of digital screens were used by children and teenagers, and that has given rise to increase in spectacle wearing in many children. Even today, when children go to school and those who have spectacles, they must use along with mask. Now, when you use spectacles with mask, then there is fogging of spectacles. You all must have experienced it. So how you should avoid it? So I've shown in this photo, you can put a sticking plaster on the mask and then you can use the spectacles. Reduce the digital screen time. If not needed for your studies, please don't use it. You should always do physical exercises at home, also eye exercises at home. Yoga and Surya Namaskar are very good for eyes. There is a condition called Amblyopia Lazy Eye. What happens is sometimes one eye is weaker than the other and a person never knows about it or child never knows about it. What he does is when he tries to see with both eyes, he uses more of his stronger eye and the weaker eye goes lazy and lazy. For this, eye exercise is very important and early detection with patching of the stronger eye is very important to improve the power and the capacity of the weaker eye. So amblyopia is a very, very important condition which needs to be detected at an early age. Vision correction with contact lenses is very popular, especially among girls and among players like football players and cricket players. They want to use contact lenses because contact lenses give better visual field. Visual acuity might be similar to specs, but visual field is more, and then there is no obstruction on your face when you are batting or bowling or when you are playing football. And girls mainly use contact lenses for cosmetic purpose. There are also cosmetic contact lenses available in various colors. And most important, contact lenses are used for the therapeutic purpose as well. We call them bandage lens. Whenever there is any wound on our body, we put a bandage. Similarly, if there is a wound in the eye or on the cornea, we do use bandage contact lenses. One must understand how to take care of contact lenses. As I told you, contact lenses provide better peripheral vision. They can be used for myopia, hyperopia, astigmatism, anisometropia. That means if the number of both eyes is different, then contact lenses are more useful. There are various types of contact lenses like soft contact lenses. There are gas permeable rigid contact lenses. Remember one thing, that this cornea doesn't have blood vessels. So oxygen to the cornea is provided not through the blood, but from the atmosphere. So if you use a contact lens, it's a foreign body and maybe the oxygenation of cornea is reduced. So what we need is either soft lenses or gas permeable hard or rigid lenses. In gas permeable rigid lenses, the oxygenation of cornea is better. So that is the reason why you need gas permeation. So these are very important instructions. Whatever the eye doctor tells you, use contact lens as per that schedule. If he tells you to wear for 6 hours or 8 hours, don't exceed this time to 12 hours or 16 hours. That will affect your cornea and damage your eye. Always follow the directions given from your doctor. Cleanliness is of utmost importance. While wearing the contact lenses, washing your hands is of utmost importance. Same way, cleaning of the contact lens or disinfecting them with the solution prescribed by your doctor is very important. Cleaning of the lens case, it's also very, very important. Many a times I see patients bringing their lens cases so dirty. It should not be like that, because remember, you are putting the lens inside your eye. So directly you are carrying some infection to your eye if your lens case is dirty or if your contact lenses are dirty. Check the bottle of your solution regularly and check for any infection or any dirt on the bottle. Clean the lens case regularly. Stop wearing lenses if there is redness, pricking sensation, or watering of your eyes. And never ever use lenses used by other person. Here I must tell you, I had a very bad experience with one patient. There were 3 friends. They bought cosmetic contact lenses because there was a scheme going on, do pay ek free. They bought those 3 pairs and they were exchanging pairs among themselves. All 3 of them got a very bad eye infection and now they cannot wear lenses at all. somehow have managed their corneas and they are back to spectacles, but please don't do such things. Corneal refractive procedures, they alter the curvature of the cornea so that the light focuses more precisely on retina. The goal of refractive surgery is to decrease the dependence on eyeglasses or contact lenses. Healthy people above the age of 18, this is very important because they should be above the age of 18, and most important, their refractive error should become stable. Their spectacle power should become stable. If it is still increasing, then one should not do refractive procedure at that particular age. They have to wait. Contraindications for refractive procedures is any ocular disease. I'll come to that. There are so many ocular diseases. I'll talk about that. But any ocular disease, one should not go for the refractive procedure. And any autoimmune or connective tissue disorder we call, that will impair the wound healing of the cornea. So if that is in the body, a person should not go for the refractive procedure. There is another refractive error called presbyopia. It occurs when a person reaches the age of 40 or maybe 39 or 42. At this age, because of aging, the lens becomes more rigid and the flexibility is gone, and the accommodative power of the person is gone. For this reason, he is not able to read clearly, and this person gets reading glasses, or in Hindi Marathi they call chalisi lag gayi, chalisi lag gayi. It is because of the age related issue. Now we come to the main, and you all must have heard about cataract. As we talked about aging process, at the age of 40 you get chalisi, still you grow further, and because of aging, a person maybe at the age of 60 or 70 gets cataract. This is called senile cataract. The lens of the eye can be compared to camera lens. So it bends the light rays that come into the eye and makes us to see clear. It also adjusts the eye's focus, letting us see things both close and far away. As we age, the proteins that make up the eye's natural lens can clump together, and these clumps are the cataracts. So what happens is the lens which was transparent, now it becomes opaque, and this opaque lens is called cataract. Can you see in this picture? This is a surgical picture. So this is how the cataractus lens looks. I have just shown this picture to tell you that how the cataractus lens looks like. Cataract is a curable blindness. After surgery, a person can see clear. Visual impairment due to cataract can be rectified only by surgical removal of lens and replacement with the synthetic intraocular lens. So this is a schematic presentation. So can you see a clouded lens over here, whitish? So this is a clouded lens is removed with the help of surgery, either by laser or either by phaco or manual surgery. And here, this is the IOL implanted inside. So a person can see clear. So there are various treatments. So definitive treatment, as I mentioned, is the removal of the crystalline lens with implantation of synthetic IOL. That is a surgical process. Many years we were using ECCE with sutures, like with stitches. But nowadays we don't use any stitch for cataract surgery. Either we can do manual small incision cataract surgery, which is a very good technique, and especially for a country like India, where many people are poor and we need to do a lot of eye-camp surgeries, where this surgery gives the best possible results. Phacoemulsification is a very good technique, and different technological advancements, we have got better and better phacoemulsification machines. So this surgery is done with the help of a machine. While flax, there is a femto laser assisted cataract surgery, where this way you can see in this picture, traditionally we can remove the cataract by doing the capsular axis like this, or here the capsule is removed with the help of a laser. So these are different techniques and all are excellent. It's a very, very safe procedure. If you all are students or your grandparents, if they wish to undergo cataract surgery, tell them it's a very, very safe procedure. It's a daycare procedure. Usually they do not have to get admitted. The surgery is done and they can go home walking. But some important preoperative precautions we have to take. If a person is suffering from diabetes, high blood pressure, ischemic heart disease, then control of these diseases is a must. A physician or a cardiologist has to control this, and he has to mention about his physical condition, whether he is fit to undergo this surgical procedure. A thorough eye examination is very, very important, and we have to rule out if there is no other condition in the eye before undergoing cataract surgery. Allergies to medicines and anesthetic eye drops need to be ruled out because this surgery is done by putting anesthetic drops. Nowadays, we usually don't give any injection to the patient to give anesthesia. So it is done under topical eye drops anesthesia. So we need to know if the person is allergic to that. And post-operative care is very, very important. The surgeon gives his best, but after that, it is the responsibility of the person who has undergone surgery. So he has to wear glares. He may be some safety goggles or protective goggles. He has to put drops regularly. He should not rub his eye. He should not immediately go to any crowded places like weddings and all, because many others might be having some eye infection, so you might catch the infection. So all these instructions are given by the eye surgeon. Those they have to follow. Intraocular lenses are available in different types nowadays. So monofocal, they can improve the vision only for long distance or mid distance, whichever the patient's need is. But when it is trifocals or multifocals, the long distance, the intermediate distance, and even the near distance vision is improved with the same intraocular lens. There are also toric IOLs available where the astigmatism, which I explained to you earlier, can be also improved by using this lens. And toric multifocals, they improve the astigmatism as well as the far distance, intermediate distance, and the near distance. Now we come to another important eye problem, and that is glaucoma. Why glaucoma is important? Because everyone knows about cataract. मोतिया सबको पता है. But glaucoma, और जिसको काला पानी बोलते हैं हिंदी में और काच बिंदु बोलते हैं मराठी में, this is not really known to each and every person. Because you are students, you must carry good information and correct information about glaucoma to the society. There is some fluid inside our body. Let me show you. Okay, so this fluid is created from the ciliary processes inside the eye. Now this fluid comes and it is drained out. It is a regular continuous process going on. Suppose the drainage is stopped, blocked drainage channel. What will happen? The fluid will get accumulated inside the eye and it will create pressure. So there is pressure built up inside the eye because the fluid is not able to drain out. When this thing happens, it creates pressure on the optic nerve. And this optic neuropathy, this is called optic neuropathy. See this is a normal optic nerve, and see this has become completely white or pale. This is because of the pressure on the eye and the optic neuropathy. So increase in eye pressure causes optic neuropathy and it causes loss of vision. Now, many a times it is silently blinding. Person doesn't know that it is happening inside the eye. So whenever you go for your eye checkup, maybe just for your refractive error, especially women around the age of 40 or above, when they are going for their eye checkup, they must request the eye doctor, and the eye doctor also suggests to check their eye pressure and to do their glaucoma screening. This is very important nowadays because we are seeing glaucoma is on rise. So there are various types of glaucoma. There can be acute angle closure. Now this is lucky to have because a person has symptoms. There is redness, there is pain, there is blurring of vision. A person rushes to the eye doctor and this is an acute angle closure glaucoma, and which can be treated immediately by doing a small peripheral iridotomy with the help of laser and giving medicines. and the vision can be preserved. But the second variety, which is primary open angle glaucoma, is very, very dangerous because it is silently blinding. The person doesn't have any symptoms, and one fine day he or she realizes that he is not able to see anything peripheral. It is like a tunnel vision. How you travel in the tunnel, at the end of the tunnel there is light. Exactly like that happens in glaucoma. Like you can see only a tubular or tunnel vision and you are not able to see the peripheral vision. So screening is very, very important. Whenever you go for just change of glasses to your eye doctor, please request for having glaucoma screening. And especially if your mother, if your aunt, if your sisters have suffered, or if your dad has suffered from glaucoma in the past, then there is a strong genetic history, then there is a strong possibility of having glaucoma. So screening test should be done. So nowadays we have a lot of technological advances where we can do a lot of tests and we can diagnose glaucoma. So this is I'm just showing this. This is the field testing done with the automated perimeter, and the earlier picture, which this is the optic OCT we call it, where the optic nerve head is judged for whether there is thinning and whether the person is having glaucoma. Remember one thing, glaucoma, once it happens, it cannot be cured, but it can be kept under control. It is something like hypertension or diabetes. You have to take medicines all your lives. So if the eye drops have started, some people feel that usually doctors write, use it for 3 months and show me after 3 months. People feel that it is to be used only for 3 months and they just forget. And after 1 year they come and at that time they have deteriorated. Please don't do this. If you have to use the drops all your life, means all your life, and you have to keep proper follow-up. As and when the doctor calls, you must see the doctor. There are surgeries available, there are laser treatments available, but let me again emphasize, these are just supportive treatment. It is not cure, and once the vision is lost, vision cannot be taken back. So you have to preserve that vision. So to preserve the vision, you have to control glaucoma and detect it early. So early detection is very important, which can be done through screening and through screening only. As I told you, in acute congestive glaucoma or acute angle closure glaucoma, the eye is red. There are many other conditions when you get red eyes. Most common, you all know, is conjunctivitis. But there are many others like corneal infections, as I mentioned, glaucoma, CVS, you all know, computer vision syndrome, which has become a very common condition nowadays, and scleritis. You get red eyes. We'll go one by one to know about this. This is conjunctivitis. I think everyone sometime or the other suffers from conjunctivitis. You call it sore eyes, but remember, conjunctivitis can be of various types. There are symptoms like there is increased watering, there is eye pain, redness, gritty feeling, blur vision, sensitivity to light, you can't bear the light, itchiness in the eyes. Sometimes both the lids are swollen and they get matted up. Conjunctivitis can be of various types. It can be bacterial when there is yellowish discharge. It can be viral when there is clear discharge, or it can be allergic. But remember, whichever type it is always contagious. Viral conjunctivitis is more and more contagious. So whenever a person is having conjunctivitis, first and foremost, he must wear protective goggles. Second thing is wash your hands thoroughly. Always clean your eyes clearly and keep hanky, towel, even pillowcases separate. Try to isolate yourself if you are having conjunctivitis. Remember one thing, many a times people have this habit of going to a chemist to buy medicines for conjunctivitis. मेरे को sore eye हो गया है, मुझे medicine दे दो. And they just dispense some medicine. Many a times these medicines are steroids. Please remember, using steroids without prescription is not correct. Steroids can harm the eye. Steroids have a lot of side effects. So please do not buy eye medicines, eye drops directly from the chemist without the prescription of an eye doctor. Last year we have done this program of sensitizing all chemists not to give any steroid eye drops to any patients. I've seen many cases by using these steroid eye drops, people have lost their eyes. So remember, friends, never use steroid eye drops without the prescription of a doctor or without showing a doctor. Eye doctor sees you on a slit lamp by microscopy. They check with some staining, and if the corneas are clear and if they are confident enough to give steroids, they give steroid eye drops only under their supervision. So steroid eye drops are to be used only under supervision of an eye doctor. So please don't buy steroid eye drops from chemist and use for your eyes. Eyes are very precious, vision is very precious. You can lose vision because now, why I'm talking about conjunctivitis, during COVID pandemic, we saw many patients who presented with conjunctivitis and they turned out to be COVID positive later. Many eye doctors who were seeing patients, many times patients were coming who were asymptomatic and they were just showing their eyes. But eye doctors who got conjunctivitis and they were COVID positive. So even COVID virus can cause conjunctivitis. So I'll just enumerate what all we saw during COVID. There were red eyes, there were dry eyes, there were paralysis of the eyes we saw during COVID. Vascular, that is the blood vessels which supply the eye, got occluded and many people had vascular occlusion. There were retinal bleeding. There was uveitis noticed. Endogenous endophthalmitis, that means the whole eye got infected due to COVID. And you all must have heard about black fungus, though it is a misnomer, but mucormycosis you all have observed during those days, and you all have seen many patients losing their eyes because of mucormycosis. So conjunctivitis was the most common ophthalmic manifestations documented in COVID-19 patients. And remember, again, I have written over here, lubricants, and the disease is self-limiting. So topical antibiotics may be added to prevent bacterial superinfection, but not the steroids. I'm again and again emphasizing on this. You should not use steroid eye drops. Allergic conjunctivitis is more common. It can be due to dust. It can be pollen due to some food allergy, maybe some perfume, maybe some chemicals. There are n number of allergens which can cause eye allergies. A person has to find out to what he is allergic to. Then only the allergies can be controlled. Allergic conjunctivitis may respond to treatment, but unless and until the underlying allergies are treated, again and again you will get, whenever you will get exposed to that particular allergens. There are anti-allergic eye drops available. So they are given for these conditions. Again over here, because you get a lot of itching and all, sometimes people start using steroid eye drops. Temporarily you get relief, but that is not the solution and they have a lot of side effects. Even people can get glaucoma due to use of steroid eye drops during allergic conditions. Simple thing to prevent the itching, or if there is itching, to control it, is the cold washcloth over eyes. Just take some cold water or normal water, put some cloth into it and keep on your closed eyes. Your itching will subside. Always keep cleanliness. If you are allergic to dust, everything needs to be clean. Wash your hands thoroughly. Avoid allergen, and those who are having allergies, they should avoid using contact lenses because the allergies can increase by using contact lenses. If you are using contact lenses and you are allergic to contact lenses, you can get this giant papillary conjunctivitis. If you develop this is because of using longer duration contact lenses, or some contact lenses, you know, there is expiry date. If you are still using it, then you can get this kind of giant papillary conjunctivitis, which is commonly seen in contact lens wearers. One must immediately stop wearing contact lenses, and it needs to be differentiated from other types of follicular conjunctivitis. So see your eye doctor and start using glasses. Don't go for contact lenses till your giant papillary conjunctivitis is completely subsided. Immediate attention is needed for some other infections of the eye. You all must have got some time in the life swelling like this. Sometimes near your nose or in between eye and nose, you can get a swelling like this. This is called acryocystitis. See, in our eye, there is normal tear. There is a lacrimal gland inside in the eye, above the eye over there in the orbit, which secretes tears. Now, there has to be some way for those tears to drain out. So that tearing, that tube is over here and which opens into the nose. Suppose there is blockage of the tube or of the lacrimal sac, then you can get acryocystitis infection like this, and there can be even a boil or swelling formation, sometimes pus inside this. Sometimes there is a cyst formation like this inside the infected lid cyst inside the eye. So you need to evert the lid to check this. I'll show you something. Yeah, this type of swelling you all must have got. They call it Anjani. Many people say that I have got Anjani, or in vernacular Marathi they call Ranjanwadi. So this is Anjani Ranjanwadi. Inside you will see this. So this is a Meibomian cyst. The duct of the Meibomian gland gets obstructed. So sometimes it is painless, it is firm, but if there is pus formation, then it becomes painful. You have to see the eye surgeon or the ophthalmologist, and it's a simple surgery and one can remove this. Now we come to another important thing is the blepharitis. Can you see the lid margin over here and the eyelashes? Can you see crust? Many people get crust. It is something like dandruff in your hair. At the roots of the lashes, you see crust like this. So blepharitis is usually seborrheic dermatitis, or it can be even bacterial infection. So here I have shown schematic. Just see the lid margin becomes like this, and continuously the child or a teenager, it is more common in children and teenagers, they start itching the eye. When you itch, you know, from your fingers and from your nails, you carry infection to the lids and it can turn into infection. So blepharitis, there are various types. One can have just the dandruff-like thing, or one can have even the ulcers like that. So you need to show the eye surgeon. It does have, some relation. We have observed this with your exams. When the exams are nearby, maybe you are doing late night studies, or maybe you are tense. In that case also, you get a lot of blepharitis in those exam days. We see a lot of students come to us for this. So remember one thing, you should study throughout the year. You should be prepared well for the exam. Don't do late night studies. Take proper rest. And if you are having some refractive error, use glasses while studying. Now this condition you must have seen in many people, where the layer of the eye, this is called conjunctiva, grows on the black portion. This is very common in India, especially among farmers who get exposed to sun. Because of the sun rays, this condition is very common. Even we see this in sports person who are outdoor sports person, because they are getting exposed to. Nowadays, we have got very good treatment modalities, surgical treatments. We remove this and we put a graft to this, and this can be cured. But it is better to prevent it. So prevent the dryness of the eye, prevent the sunlight, direct sunlight exposure, and use lubricating drops, okay, to keep the eye less dry or to keep the eye lubricated. So this is very important for pterygium. Now, can you see a small nodule over here? This is very common among children again. If this type of nodule is there, the child needs to be investigated by the pediatrician as well as by the eye doctor. Now you can see a nodule like this. This is called scleritis or episcleritis, and this occurs mainly in women or even in men. But usually it is associated with some systemic condition or some bodily conditions like arthritis or back pain, knee pain. That is why we call the eye as signals. Many times people do not have arthritis or they don't have any pain in the knees or pain in the back. But when we see this, we ask them to investigate themselves, and early detection of arthritis can be made, and then they can be treated. They can be started with even simple physiotherapy. some exercise and they can control their arthritis. I have many patients whom I have diagnosed with this some 15 years before they actually got arthritis. So this is very important. So they keep themselves active physically and then they can prolong the arthritis or the knee problems. So this is very important. Now we come to some eye emergencies. What eye emergencies? There can be trauma. Can you see this picture where the lid is torn? This can occur anywhere in the industries as well as at home. While playing in the classroom, in the school, this is a dire emergency. Whenever there is an eye injury, immediately the child or teenager or the student should be rushed to the hospital for taking care of that before it causes any further complications. Red eye, which is very painful, is also a dire emergency. Severe headache, should also see the eye doctor immediately because the headache can be due to eye problem, and as I mentioned, the eyes are the windows. We can diagnose some important things which lead to headache. For example, the brain, if there is swelling of the brain, since our nerve of the eye is connected to the brain, the swelling of the brain is reflected in the optic nerve, in the nerve, which can be seen through the eye. I'll show you the picture. So if there is headache, you should immediately go to the eye doctor and rule out any eye problem, or if the nerve is okay, or if there is a swelling of the nerve. And sudden loss of vision. Anytime if it happens, you should rush to the eye doctor. Many times people feel, हाँ मुझे एक आंख से तो 2 दिन से दिख नहीं रहा था, मैंने सोचा ऐसे ही कुछ होगा, दिख जाएगा, नहीं दिखता. You have to rush immediately to eye doctor when there is sudden loss of vision. So we come to trauma. It can occur in industries, to laborers, in the war, children, road accidents, or in the fights. See this kind of, can you see the injury? Even the inside structures have come out. But let me tell you, this can be done properly if operated. This can go inside and the eye can see properly. A person can see properly. So if you bring the patient in time, his vision can be preserved. His eye can be saved. So whenever there is injury, immediately rush. Whenever there is foreign body, again, this is very important. Can you see this small foreign body? This is on an everted lid. It is inside. We call it tarsal foreign body. Many a times when you go on two-wheeler, you get something inside your eye that goes and sits over here. You don't know. You wash your eye. Still there is pricking sensation. You must go to eye doctor. Again, here I am telling, don't go to chemist. Once you go to chemist, they give you some drops. Those can be steroids. Unless and until this foreign body is removed, you are not going to get any cure. So you need to go to eye doctor. Just removal of this foreign body and you are perfectly normal. Now this foreign body is in the black portion or in the cornea. Basically cornea is transparent and inside is iris, which is black or brown or blue. When we see blue eyes, it is actually the iris, but the cornea is transparent. When you have a foreign body over here, this needs to be removed. If a foreign body remains in the eye, it is dangerous for the eye. This is not going to go with any wash or with any eye drop. This needs to be removed, and it's a very simple procedure. It is done on a machine by looking through a microscope with a small disposable needle. We use all aseptic precautions while removing this because there should not be any kind of infection occurring to cornea. Because if you get infection in the cornea, there is a high risk of losing the eye and losing the vision. So this foreign body is very, very important and crucial. One must rush to the eye doctor. If there is a foreign body like this, and if by chance you use steroid eye drops, then you will lose the eye. Now we come to corneal ulcer. I showed the foreign body in the cornea. If there is wound in the cornea, it is called ulcer. So the patient presents with a lot of watering. He cannot bear light. He cannot open the eye. There is severe pain and the vision is gone. It more commonly seen among farmers or gardeners because sometimes a twig, injures the eye and then they get the eye infection and the eye ulcer. They have to rush to the eye doctor because on day one, if we start the treatment, they can have perfect vision. But if the ulcer extends and they come late, then that ulcer can leave behind and scar on any transparent thing, means your vision is less. And when there is that kind of scar, you all know what we need to do is we have to do transplant, which is very difficult. So it is better to rush to a doctor in right time, start the treatment at right moment so that the ulcer is also healed and your vision is perfect. Can you see this pupil? This is so beautiful, like a flower, but it is not a beautiful condition to have. Many a times, you see on the net, on Google, some such pictures of the eyes, heart-like pupil, and they say, ye mera dil and all. But it is not good to have because it is chronic uveitis. I talked about cornea, and inside it is iris, which is a colored layer. If that iris gets inflammation, then the pupil becomes like this if it is not treated at right time. And patient has permanent reduced vision. So, and they can develop even the complicated cataract, which is also difficult to remove. So whenever there is a red eye and there is inflammation, there is pain, there is diminution of vision, it is uveitis, so you should rush to a doctor. Now, these are a few conditions where you can have sudden loss of vision, which is again an emergency, I've told you. Central retinal artery is the main artery which supplies the eye. So if that artery gets blocked, the circulation to the eye stops and the patient will lose vision. So if you have sudden loss of vision in one eye, rush immediately because there is some golden hour. In those golden hours, in the first hour, if we treat, we have something so that we can remove the blockage of the artery and you can see clear. Same is true with central retinal venous occlusion. Veins are the veins that collect the blood. They drain the blood back. So if there is occlusion, again the bleeding will occur. Again, you need to take the treatment immediately. Otherwise, you have to take injection in the eye to take care of that bleeding and to improve the vision. So anything happens, you should go to eye doctor for sudden loss of vision. There can be vitreous hemorrhage, which is very common in diabetic people. In diabetes is very common in India. Every household nowadays we say is one or in every second household we say there is a diabetic person. It could be because of our lifestyle. It could be genetic, familial. It could be because we eat lots of sweet. Any occasion, Diwali ho, Dashera ho, Ganpati ho, we eat all sweets. So maybe generations after generations, this is our lifestyle. So India is going towards becoming capital of diabetes, and these diabetic people get diabetic retinopathy, diabetic eye disease. So retina can have bleeding, which can come to vitreous, and patient loses vision. So he has to rush to the eye doctor. There can be retina detachment. Retina can just come out of its own position. This also gives sudden loss of vision. And then there can be reasons in the brain, because finally the optic nerve carries all the signals to the brain. So the brain has to be perfect. If there is infarct, or if there is no bleeding, or if there is no blood circulation to that part of the brain where the vision is seen, then a person will lose vision. So again, it is all related to the systemic diseases. If a person is diabetic, if the person has hypertension, high blood pressure, these things should be kept under control. Take proper medications and have good lifestyle. Walking, exercise, get up at regular, in the morning at regular time. Don't sleep just like that. Don't do late night work. Sleep at right time, get up at right time, do Surya Namaskar, do yoga, go for proper walks. These are very important things, because if you keep all these diseases under control, then your vision will also be maintained. Even during pregnancy, if there is any problem, the lady should see an eye doctor. Because sometimes during pregnancy also the blood pressure rises. If the a lady is already diabetic, or if she gets gestational, we call diabetes, that is during pregnancy, that can affect the eye. Or I can say even the eyes are the signals. So we can detect if something wrong is happening in our body systemically through the eyes. So that's what I was telling you about the fundoscopy. This is a machine with which through the pupil we can visualize the retina inside, and through this retina we can diagnose hypertension, we can diagnose diabetes, we can diagnose pregnancy induced things. Everything can be diagnosed through this fundoscopy. This gives signal, so that is why we call eyes are the windows of the body. So this is the fundus. See, I can see, and now here this is the central retinal artery occlusion picture, what I told you just now. So the main circulation to the eye is stopped, so the patient has lost the vision. Same, see, there is hemorrhage. If there is hemorrhage, bleeding inside the retina, so rest of the body may not show anything, but through the eye we can see the retina has got hemorrhage. So we can ask the patient, are you hypertensive? Patient says, nahi, mera to BP kabhi nahi badha tha. We check the BP, BP is high. So these things can diagnose the thing. Now see the nerve. You can compare these two pictures. The nerve looks like this. Now see the nerve over here. There is all swelling. If the nerve is swollen like this, again, there is a possibility of losing the vision. So these things can be diagnosed. Now I come to a very important topic of today, and that is dry eye. Everyone today uses digital screens or mobile phones. Earlier, when I studied my ophthalmology a few years back, dry eye was related to, some conditions like arthritis or Sika syndrome. They were those typical conditions. Nowadays, we see dry eyes in almost everybody because we are getting exposed to digital screen for prolonged period, and to even mobiles. Especially during COVID times, we have seen dry eyes among children as well. So you all must know what is computer vision syndrome. When you are using digital screen for a prolonged period, you get red eyes. There can be gritting sensation. There will be headache. Sometimes you start seeing double, that is called diplopia. Sometimes you can't bear light. You feel like now I should close my eyes, that is photophobia. And there is severe backache as well. So all these conditions, shoulder pain, headache, backache, blurring of vision, double vision, myopia, presbyopia, everything can occur in computer vision syndrome. So how do we prevent computer vision syndrome? So reduce exposure to digital screens. There is 20-20-20 rule. After every 20 minutes, take a break of minimum 20 seconds and try to see an object at a long distance, 20 feet, 20 meters, through the window. If there is greenery or if there is some natural thing, that is much better. Friends, God has given us eyes to see more of for long distance. Human eyes are hunter's eyes. When we are working on digital screens, we are working against nature. So continuously we are working at short distance, that is against nature. So we need to take breaks. That is most important. If you are using contact lenses, stop using contact lenses. If you are continuously working on digital screens, wear glasses because they give some kind of protection. Contact lenses and digital screens both aggravate dryness of the eyes. And many a times what happens, if your work is for say about 15-16 hours, then even if the contact lens is meant for 8 hours, a person uses it for 16 hours. So that again aggravates the dryness and affects the eyes and causes redness. Lubricating eye drops is a must. At the same time, you must avoid excessive tea, coffee, and soft drinks. Avoid alcohol, avoid smoking, and avoid drugs. They also give rise to dryness, and that affects and a person goes into computer vision syndrome. Drink a lot of water. Keep yourself hydrated. You can have fruit juice. You can have coconut water. You can have simple drinking water. Keep a bottle aside and keep on drinking whenever you are working. Positioning of the screen is also very important. Whenever you are working, the position of the screen should be slightly at a lower level so that you work like this and not like this. When you work like this, there is pain in the neck. When you work like this, it is more soothing and your lids also protect your eyes. If possible, try to avoid eye makeup if you are working too much on a digital screen, because what happens in between, you feel like rubbing your eyes, and this eye makeup, when you rub, there is a possibility of causing infection in the eye. So you should avoid that. And one important thing is intentional blinking. Sometimes you are so engrossed in your work that you stop blinking, you forget blinking. So whenever you remember, just blink your eyes. Whenever remember, blink your eyes. When you blink, there is a pumping action in the eye. So the gland which secretes the tears forcefully, and the eye remains moist. Now this is the deficiency, because I understand that some students are from nutrition as well. We see a lot of signs of vitamin A deficiency in India, especially in the malnourished children, lower socioeconomic. Can you see these pictures? These are called Bitot spots or xerosis. Like the eye goes so dry because of vitamin A deficiency that it develops small spots over there, and they are very, very characteristic of vitamin A deficiency. When we see these spots, we immediately give vitamin A supplements. So there are various, this is science. In severe vitamin A deficiency, a person develops night blindness as well. So that is called XA. If there is only conjunctival xerosis, it is called X1A. Bitot spots, X1B. If cornea also gets affected, it is called corneal xerosis, X2. If there is corneal ulcer but less than 1/3, it is X3A. But if it is extending more than 1/3, then X3B. And if it happens corneal scarring, then we called it X. So how do we treat it? So these charts are available, but most important, I must tell you, if we see a child with Bitot spots, vitamin A deficiency, immediately we start vitamin A doses, and with the help of pediatrician, or in India, all the PHCs, primary healthcare centers, all corporation hospitals or government hospitals, the child can get vitamin A supplements over there, or vitamin A doses. It is also included in our vaccination program. So this is very important. Why I'm telling you, because you all should be knowing this, that vitamin A deficiency can cause eye problems and night blindness and corneal scarring, which can lead to even vision loss. One important thing one must remember, vitamin A is not a water soluble vitamin. So when it is prescribed, it doesn't get dissolved. Okay, so it cannot be drained out in the urine. So excessive vitamin A should not also happen in anybody's body. That is called hypervitaminosis. That should not happen. Vitamin A or D, they are dangerous if they are given in excess. So whenever we see any child with vitamin A deficiency, then both pediatrician as well as the eye doctor should work together to cure him. But prevention is always better. So always tell all the children in your family to check for this vitamin A deficiency signs and take vitamin A doses as per recommendation. So this is about eye conditions. Now I'm going to give you small tips at eye clinic when you should go. Regular eye checkup. If you are having spectacles, you must go for regular eye checkup, especially when the child is below the age of 18, teenager, because till then there is every possibility of increasing number. So once in a year checkup is a must. If there are any complaints like headache or the blackboard is not seen clearly, they should go. Screening of certain conditions is very important. I have told about glaucoma. Those people who are suffering from diabetes and hypertension must go for screening, because through the eye we can diagnose. I'm telling you again and again, if diabetic retinopathy or hypertensive retinopathy are diagnosed at an early stage, we can preserve the vision. If they are detected at later stage, then in spite of doing laser treatment, in spite of giving injection, in spite of doing surgeries, we may not preserve the vision. So early detection is important. So screening is important. Whenever you go to eye clinic, better go by appointment. Don't go and do crowding in the waiting lounge. Why I'm telling you, after COVID has taught us a lot of lessons. So social distancing should be maintained in hospital waiting too. Always wear a mask. SMS is for sanitizer, mask, and social distancing. So always, even now, even if COVID is on decline, whenever you go to any hospital or eye clinic, please wear mask, because there are many other people are also coming. Many children are there. Unnecessarily don't take children along with you to eye clinics or any hospitals. If the child needs an eye checkup, he should be taken. But just accompanying a parent should not be done, because he gets exposed to other infections. Do not waste time in showing the whole file. Instead, when you take an appointment, inform your eye doctor all the reports or by email. It's very easy. Most of the eye doctors nowadays, they have got their websites, they have got their emails given. So you can, send your reports by email or even by WhatsApp. Most of my patients send their reports. So we don't waste time just seeing those reports. I can study those reports on the previous day and then just give more time for eye examination. So these things, no wastage of time in the clinic or hospital for the patient. So to avoid any kind of infections which are in the air even now. If you know, presently there is also H1N1 swine flu going on. There are dengue cases we are seeing. There are influenza-like cases we are seeing. So why to give a chance for these infections? So now I come to my last slide, and I request all of you to pledge for eye donation. As I mentioned in the beginning, we are observing Eye Donation Fortnight, National Eye Donation Fortnight from 25th of August to 8th of September. So I request all of you, this is the Eye Bank Association of India website. You can directly go over there and pledge for eye donation. Eye donation can be done only after death. Right now you have to pledge so that after your death, your near dear ones can donate your eyes, and those eyes can give vision to some blind and bring light into those blind people. Here is my video. Can you hear?
Yes, yes.
So I request all of you that you must take pledge of eye donation. This is my own poem. I'm a poetess as well. So usually I try to give this awareness tips through my poem. Thank you very much for inviting me. If there are any questions, I'm ready to answer.
Okay, ma'am. Firstly, thank you for the very wonderfully detailed and thorough session, and firstly for the very thoughtful tribute that you paid to our brave doctors who lost their lives fighting COVID. Uh, from all the very interesting things you said, I do have a few things to ask you. Before that, I'd like to ask you about the prevention of blindness model in leprosy patients that you came up with. Could you
Yes.
share something about that?
Yes, definitely. I would like to say, first of all, you all must be knowing leprosy has got a stigma in our society. I was working for Dr. Bandurawala Leprosy Hospital as an eye surgeon, and I was treating all eye conditions of the patients. I realized over there that the relatives don't come, and those patients are left over there. In fact, even after cure, they don't go back home, but they prefer staying around the hospital, and there are a lot many societies over there around the hospital. So what the main problem in our hospital was, we never used to get staff, because even the staff have some stigma in their mind. So here we developed a model where the cured leprosy patients used to work as attendants for these patients. So they were like their brothers and sisters, because everyone was suffering from leprosy. These cured patients, leprosy can be cured completely, remember that. So these cured patients, since they were not going back home, we trained them as healthcare workers, as patient attendants. And I taught them how to take vision, how to take care of their eyes, how to clean the eyes. You won't believe this, but even my operation theater assistant was a cured leprosy patient. He used to assist me in operations. He used to get the operation tray, our surgical tray ready and everything. So what happened was, since the patient started taking care of the patients, I taught them the early signs as well. Okay, and with this, they started taking care of the patients, and we started detecting early cases. And with this, the vision started improving. Even simple things like small corneal ulcer. Okay, the patient's attendant used to phone me immediately, "Madam, there is a white spot I can see." I used to rush, and the patient was treated and he was cured. Otherwise, when there was no staff, who was going to look after them? Because I was giving my honorary services, I was going every 2 days in a week. But these friends were always there for them, since they didn't have any relatives. So this was the model. Then we also had awareness programs. Then I also had awareness programs and teaching programs of medical officers of PHCs. So they used to come to the hospital. And so this model was not, I won't say that this is for the surgical or this thing. This was the model, like everybody was helping everyone to detect early, so that the vision was preserved and the blindness was prevented. And then we compared how it was at Bendorawala Hospital a few years before and how it changed once we started this system, and there was a vast difference. This was the model. I had presented this in International Oculep, which occurred at Calcutta, and the Brazilian doctors and the Bangladesh, they also thought that this can be done in their own countries. So I hope they must have done it, but they had liked it.
Ma'am, that sounds amazing. It's such a novel
And even I must say that attendant, he also got some self-respect, because he started feeling very important that he was giving his services. So that is also very important, because I remember one of our attendants later on, he went and she started assisting a doctor in his village. So that was also like, you get self-respect when you are included in the system to help your colleagues or your brothers and sisters. So that is the basically model. And similar type of model was also developed for other conditions also. Like this was for ophthalmology or eye care, but otherwise also other conditions also we developed the same type of a model. So everybody helped each other, and they are very happy now also.
It sounds like a very considerate approach to treatment, and it sounds like you're not just bettering health outcomes, but also as in you're boosting the self-esteem of someone who is already stigmatized.
Yes.
That is
That is more
very.
important. That is more important, especially in leprosy.
I understand. And also, when you said that this model, you may have extended it to other specialties. So, for example,
Yes.
which other specialties have you tried
Mainly
to?
these leprosy patients, they suffer from foot ulcers.
Hmm.
Okay, and they also need some physiotherapy, etc. So over there, one of the cured patient, we trained him as giving physiotherapy as well, doing dressings of that foot ulcers and all. So they were doing mainly for those conditions.
That is honestly, I believe, like, when we're all sick and down with something, the one thing that takes a hit aside from mental health is productivity, and the fact that you kind of trained them. And,
Yes.
when your productivity is on a high, you automatically start to feel better. And you kind of have this
Yes.
hope that, yeah, you're not so, I mean, your self-esteem obviously goes to a high. I'd like to ask you about LASIK as well, since you've also specialized in LASIK. Uh, so LASIK, as you said, typically is to correct visual defects, for example, myopia, hypermetropia, and all of those things. But what if somebody has genetically inherited poor eyesight? Can LASIK be applied in those cases?
Now, LASIK is mainly for the care of the refractive errors. If
Okay.
genetically there is some other condition, then LASIK won't help, because the basic cause is something different. The
Mhm.
root cause of the low vision is something different. That's what I said. Before doing any refractive procedure, we have to see the eye. If there is no other ocular disease inside, then only one must go. So thorough eye examination is most important before going for any refractive procedure.
Okay. And ma'am, since you're also an eye surgeon, I mean, I'm sure you must have operated on a number of nervous patients, because I believe you were assuring that cataract surgery is very safe, in fact. So, because we have this unconscious urge to just move something away from our eyes, we have very strong reflexes to keep things away from our eyes. So, how have you dealt with patients who've been nervous? How have you put them at ease and kind of,
See, a lot of
assured them to stay
counseling
put?
is needed. A lot of counseling is needed. And, patient has faith in you. I believe in that. I have a lot of communication with all my patients, and families after families come to me. Like I develop that kind of bonding. So my patients are never so nervous. In fact, they are very, very confident when they come inside. Then in the operation theater, sometimes I have light music as well, and then I just talk. And while talking, I just operate. So while I'm talking, they don't even understand. You won't believe this, but I have operated on my dad, and he didn't realize that it was done. Later on, he thought कि कुछ तो हुआ. Then he asked me, क्या मेरा BP बढ़ गया था? क्या क्यों नहीं surgery हुआ? I said surgery तो हो गया. So he was shocked. He said surgery भी हो गया. So while talking to him, it all happened. So if you have that kind of bonding with your patients, then it happens. On that note, I must tell you about this leprosy patients also. When I used to visit this leprosy hospital, my own son was very small. So there was nobody to look after him at home. So he used to accompany me to hospital, and he used to play football with the children of those leprosy children as well. So, that kind of bonding you should develop. So he was friends with them. Today he is also a doctor, but that builds up inside you, within you. Then only you should go and become a doctor. That kind of apathy, sympathy, whatever you say, I would say love for the other person. That if you have, then only you should become doctor. And if you have that bonding, my patients are never nervous. And if they are nervous also, once they enter into OT, and later on they themselves tell me कि madam अभी तो बहुत अच्छा लग रहा है since you are around. So I think it happens over the years. It cannot happen in a day. So that kind of thing you need to develop with your patients.
I wholeheartedly agree with you that the true essence of being a doctor lies in compassion and empathy and just making your patient feel at ease, because as it is, they're so plagued with, terrifying thoughts about their condition. So coming to that, I think when it comes to visual, any condition that you have in your eyes, you have this fear that what could happen? Could I go blind? What if I lose eyesight in one eye? What if something goes wrong? So there's this sort of stress, a psychological stress that you have. But let's say things go well. And you also said that counseling takes place before a surgical procedure. But does counseling also take place in post-operative care? Is it part of that?
Yes.
Because, yeah.
Yes. A lot of post-operative care is needed because we give our best in surgical skills. Rest of the things are dependent on the patient and his family. That is most important. So counseling is not just of the patient, but the whole family we need to do.
Okay.
Okay, and everybody, they have to remain together. And believe me, nowadays patients are very happy with cataract surgery. They hardly have any issues, and even the relatives are very happy. And they put drops because regularly you have to put drops.
Yes.
That is a must. Yeah, and you have to avoid crowded places because infections are at rise. So you have to avoid crowded places. These are the only two things you have to do. So eye drops, and they do it. And this kind of fear you say, that sometimes patient has fear that will I lose my eye and all. I must tell you, nowadays, most of the eye conditions have a cure. If we detect early, the vision will be preserved. So nobody has to worry about it. Technology has developed. A lot of advances in medicine has occurred. Like in cancer. Cancer is now, we say it can be cured. Same way, vision can be preserved throughout your life if it is detected early. early detection is most important, and so screening is needed, whether it is glaucoma, whether it is diabetic retinopathy, or whatever is the condition, even cancers of eye. If they are detected early, then they are cured. You won't believe, but one of my patients who was diagnosed of an eye cancer, retinoblastoma, when he was 2 years old, today he is in college and enjoying life. So
That's wonderful.
these are the things, that gives full satisfaction to any doctor, and that makes our life also so very happy and good. So I like to have such patients, when he comes, every year he comes and gives me something, a greeting card or something. You love that. So that is a kind of bonding what I am talking about. So every doctor has such a bonding with their patients.
It's true, ma'am. I think the best thing for a doctor is something that a doctor derives satisfaction from most is just to see their patient healthy and thriving and happy and just living their best life after any medical procedure. So on a lighter note, I'd like to ask you, I've heard of some very odd myths surrounding eye health. For example, I've heard people say don't cross your eyes deliberately, else you will end up with crossed eyes. So are there any other myths that you've heard and as a doctor you would like to debunk?
Yeah, there are some myths. In some villages, if the baby is born, they put mother's milk in the eyes of the baby. That should not be done.
Okay.
They also put ghee in the baby's eyes. That should not be done. Okay, because mother's milk, when the baby is drinking, that has a lot of enzymes and a lot of good quality milk, so that the baby develops good immunity. So that milk is to drink, not to put in the eye. Ghee should never be put in the eye. Many people put a lot of kajal and surma in baby's eyes. That should also be avoided. If they feel ki nazar na lag jaye, then they can put it somewhere on the thigh or somewhere here, but not in the eye. That causes eye infection as well. Then for glaucoma, I told you the eye pressure increases. There are some places where they put leech. Leech?
Yes, I do. Yes.
They put to the eye so that sucks blood or something.
Bizarre.
This will never cure glaucoma. For glaucoma cure, you need early detection and eye drops. Sometimes you need laser treatment. This is a very dangerous thing to occur. Then there are some buas, or what you can say, those conman. They call themselves they can cure. They just put hand or aapki vision aa gayi and all that. Nothing happens. Don't waste money and time on such things. Always follow the scientific knowledge and the treatment, and follow whatever the doctor tells you. If you're not happy with one doctor, I would always tell, take second opinion, take third opinion, but don't go to the such buas and all, and some pani dala or vision aa gaya. No, there is no water, no magical water which will bring back the vision unless a proper treatment is given.
Correct.
So such myths are always there, and बोलते हैं ना कि हमारे यहाँ education level is not that good. Now I'm very happy today, this is women college and girls are getting trained, and I'm very happy, लड़की ने सीखना ही चाहिए. And every beti, because when see, Mahatma Phule, you must have heard.
Yes, I have. Yes,
is the pioneer of the women education. What he said, कि जब एक लड़का सीखता है, एक लड़का ही सीखता है, but जब लड़की सीखती है, पूरा घर educated होता है, because it's the mother, who teaches. So I'm very happy that today I am here with these all girls, so they will carry this message to their families, if they are from the villages, or if there are maids working, if they have relatives in the villages, they should carry this message and awareness to them, and girls can do it. I have a daughter as well, and she also is a doctor. So I'm very proud, the girls should be on their own feet, and they should educate themselves so that the whole family and the whole country will be educated.
Absolutely. I completely second those thoughts. So, ma'am, on a concluding note, I would like to, you also referred to the pandemic and where people had increased screen times because everyone was working from home. Now, you also highlighted a few things that people must do to kind of reduce their screen time to sort of care for their eyes. But in your opinion, or what advice would you give to companies who have such rules where people have to be glued to their screens and they have to aim for productivity, what would you suggest to companies who do this, or recommend any changes in policies as such from a doctor's perspective?
Yes, they have to give breaks. First of all, this is most important. They have to give breaks. I have taken lectures for companies as well, and Computer Society of India Pune chapter had also invited me, and I guess my talk is on their website as well. All precautions. So companies have to give breaks. Most important is those shift things. See, every person needs 8 hours sleep. Those company shifts, because of that, some days they are sleeping in the daytime, sometimes they are sleeping in the night time. So the whole rhythm, biological rhythm is getting disrupted.
Correct.
So it is not just for eyes. You just talked about mental health. Because of lack of sleep, there are many mental health issues, there are relationship issues, and there are many more. So companies have to think about it. Digital screen, they can have some screen protection. The people can use protective glasses, but this is continuous work, long hour works, and different shifts must be avoided. When one can have part-time, 4 hour shifts. One can just work for 4 hours. You will have more work done. In fact, the resultant would be more. That's what I feel. It should be short duration work, and there should be breaks. This is must. And second things are those parties, alcohol, smoking, and drugs. They have to be banned from the companies, because they are the culprits for causing more dry eyes, again the mental health issues. And we are see, this smoking has got nicotine, and nicotine also affects the optic nerve. Same thing happens with tobacco addicts. Okay, not just I didn't mention about that, but there are many tobacco addicts. Even the maids, they just put that tobacco. And many workers also, they put, who work on the construction line. So all those affect the optic nerve. So companies, whether they are IT companies or construction lines, any companies have to take care about this. Health is more important than anything else. Money is much less. I feel health is more important. So everyone has to take care of health.
Correct, ma'am. That's absolutely correct. And ma'am, before we go, I'd like to thank you for your very thoughtful poem and your request that people pledge for eye donation. I honestly believe that bringing light to somebody's lives is definitely equivalent to saving someone's life. So thank you so much, ma'am, for, as I said, your thorough, your comprehensive and fantastically detailed presentation on the eye. I'm sure a lot of lessons have been learned today, and that our viewers would wholeheartedly appreciate your time and the effort you put into this session. So once again, thank you so much for your time.
Thank you. Thank you very much for inviting me. It's my pleasure. I always love to give such talks because that brings awareness, and it should be like, a chain. When I'm teaching somebody, they have to teach someone. So when it is a chain, everybody gets educated and the awareness program is more successful. I request again for eye donation, please, because I heard that you are more than 25,000 students. So if they all pledge, just imagine how much the word would spread to everyone for eye donation. There won't be any blindness in this nation, in this world. Okay, thank you very much for inviting.
Thank you so much, ma'am.
Welcome to Rai Soni Group, a vision beyond.